So, good evening, guys. Today we are going to talk about the most important topic from the surgery, that is mastectomy. First, we'll start with a definition. Uh, I've already done with the breast cancer in the last video, so I'll provide you the link in the comment box. You can just go and watch the video. Okay. So first, we'll start with the definition. Mastectomy is the surgical removal of entire breast with or without axillary lymph node. Sorry, with or without axillary lymph node dissection, usually performed for breast cancer, right? So mastectomy is a surgical removal of the entire breast, okay? In this, it can the surgery can occur with or without removing of the axillary lymph nodes, okay? Usually performed for breast cancer. Types of mastectomy. So there are four types. First is the simple or total mastectomy. In this, there is a removal of entire breast with nipple and areola. Axillary nodes are not removed. Okay, axillary nodes are preserved. Second is the modified radical mastectomy. This is the most common and important mastectomy. Okay, this is the most common and important surgery. It's very common, commonly practiced. So most important and most commonly used method, as I told you, removal of breast with axillary lymph nodes. Pectoralis major muscle is preserved. Okay. Radical mastectomy, removal of breast, axillary lymph nodes, pectoralis major and minor muscle. And this is rarely practiced. Skin and nipple sparing mastectomy. Breast tissue removed, skin nipple preserved, used for reconstruction. Right? So we have seen four types. First is the simple or total mastectomy. In this, the entire breast is removed with nipple and areola, and axillary lymph nodes are preserved. Second is the modified radical mastectomy, mostly practiced mastectomy. In this, there's a removal of breast with axillary lymph nodes. Yeah, axillary lymph nodes are preserved, and in this, there's a removal of breast with axillary lymph nodes. So pectoralis major and minor, pectoralis major muscles are preserved here, right? And in third, that's a radical mastectomy, a removal of breast, axillary lymph nodes, and pectoralis major and minor. So you can just see the sequence. Like it's very easy to remember. In simple mastectomy, axillary nodes are not removed, axillary nodes are preserved, right? In modified radical mastectomy, axillary lymph nodes are removed with breast, right? And thus the entire breast with nipple and areola were removed. And third one, see, in third one, everything is removed. See, pectoralis major and minor muscle were preserved in modified radical mastectomy. In third radical mastectomy, everything is removed, even the breast, even the axillary lymph nodes, pectoralis major and minor muscle, everything is removed. So this is rarely done, rarely practiced. And fourth one is the breast tissue removed. Skin and nipple are preserved, usually for reconstruction of the breast, right? Complications. What are the complications of mastectomy? So there are early complications and late complications. So early complication, hemorrhage, seroma, wound infection, or skin flap necrosis. And late complications, lymphedema of arms, shoulder stiffness, numbness of arm, or local recurrence. Now we'll come to the physiotherapy management of mastectomy, like after the surgery of mastectomy, as we are discussing the mastectomy according to the physiotherapy perspective, right? So first is the immediate post-operative phase, just immediately after the operation, right? So in that, the breathing exercises, deep breathing exercises are patient are asked to perform the deep breathing exercises, cuffing exercises, right? Hand, wrist, and elbow movements, and arm elevation to prevent edema. Why the deep breathing exercises are practiced or cuffing exercises? It's used to remove any secretion to remove the accumulation of sputum in the lungs, because mainly the bedridden patients, or in the bedridden patients, the sputum gets accumulated in the lungs because there's no mobility. So for that, the deep breathing exercises and cuffing exercises are practiced, right? Early rehabilitation phase, gentle shoulder range of motion exercises and pendulum exercises. This is early rehab, right? And late rehab, shoulder strengthening exercises, postural correction exercises, and scar mobilization, right? And what are the goals of physiotherapy? The goals are to improve shoulder mobility, right? To prevent lymphedema or to restore upper limb normal function, right? So I guess you have got the mastectomy. Mastectomy can be asked for 3 marks or the 5 marks in the surgery in the MUHS University. Okay, so just if you need the PDF of the notes, you can just DM me on Insta. I've provided you the QR. Thank you so much.